All right. Well, thank you for joining us today for this advisory on the state of health in Butler County. I am Dr. Lisa Mattix, the Butler County Coroner. With me today are the Butler County Health Commissioner, Jennifer Baylor, and the Executive Director of the Butler County Mental Health Addiction Recovery Services Board, Dr. Scott Rasmus. So thank you for joining us. The mission of the Butler County Coroner's Office is to provide accurate, thorough, efficient medical legal death investigation of violent, suspicious, unusual, or sudden deaths in the county. Our commitment provides respect and dignity to the dead while providing compassionate and truthful answers to the living. And I just want to give some recognition to my staff, who do an absolutely amazing job of covering the county 24/7, 365 days a year, serving families who have lost a loved one suddenly or unexpectedly. Today I'm releasing the 2017 statistics from the Butler County Coroner's Office. In 2017, we did have an increase in the number of deaths that we investigated. Most of the types of deaths remain fairly stable over the years, including natural causes, homicides, suicides, fatal motor vehicle crashes. But the trend has continued in increases in unintentional drug overdose deaths. In 2017, unintentional overdose deaths accounted for approximately half of the caseload in the Butler County Coroner's Office. The increase in overdose deaths was a 20% increase over the 2016 cases that we had. Of those overdoses, the majority, greater than 80% of those, involved fentanyl, fentanyl analogs, or heroin. And you remember a couple years ago, we were talking about heroin, and then we saw the transition to fentanyl. Most of the deaths that we see now are fentanyl. In the middle of 2016, we saw the emergence of fentanyl analogs. Fentanyl analogs such as carfentanil are synthetically manufactured chemicals similar to fentanyl, but potentially much, much more potent. And carfentanil was the one that came up in most of the cases. Of our fentanyl cases, over 20% contained a fentanyl analog in 2017, predominantly carfentanil, but we saw as many as 8 to 10 other different fentanyl analogs in the toxicology reports of deaths in Butler County. In 2017, we also had a greater than fourfold increase in deaths that contained methamphetamine. Those deaths typically also involve fentanyl or fentanyl analogs. We saw about the same number of deaths involving cocaine, and again, the majority of those cocaine deaths also had fentanyl or fentanyl analogs in the toxicology. Later in the year, we'll be talking about some of the other causes of death and some initiatives with those surrounding suicide, safe sleep for infant mortality, and pedestrian safety. But today, we're really talking about the increase in overdose deaths. You've heard me say that the coroner's office is the last stop on a very bad journey for someone addicted to drugs. Along that journey, there are many other community partners that are here with us in the county working to try to solve this and to try to keep people from dying. Law enforcement is doing the best they can to try to keep these drugs from coming into our community, to try to get them off of the streets. First responders are out there saving lives. The hospital is working to save people. The prosecutors and judges are trying to get these people get help for them. There are coalitions and organizations. There are families and friends working on this issue. We have to remember that education is paramount. It is absolutely necessary that we work on prevention and educating our children about this so that this trend, this unfortunate trend in deaths, stops. One of the organizations that has come together for this purpose is an overdose alerting network. It is comprised of public health, law enforcement, first responders, and hospitals as we try to monitor the immediate changes in the community as far as overdoses at the hospital or EMS runs or suspected overdose deaths that we see so that we can get that information out in a timely manner. We don't always have time to wait for the toxicology to come back or the testing to come back from the lab. So this network is trying to get that information up and out more readily. And I'm going to turn it over to Commissioner Baylor to talk more about that as well as some of the other initiatives on the public health front in Butler County. Commissioner Baylor.
Thank you, Dr. Mattix. I'm Jennifer Baylor. I'm the Health Commissioner at the Butler County Public Health Department. Health, mental health, and the coroner have traditionally worked in different spaces. That has changed recently across the nation, the state, and locally. We are now all working together on many issues that impact our citizens. There are significant crossover areas between health, mental health, and deaths, and collaboration is the key to making a positive difference. The release of the 2017 numbers of overdoses by the coroner underscores the need for our agencies to continue to collaborate and ensure changes come to our community. Within this collaboration, the health department in particular works by decreasing the epidemic through prevention, program planning, and harm reduction activities. We work generally in 4 main areas. Dr. Mattix referenced the overdose alerting network. This was led by the health department and collaborates to monitor and track deaths from overdoses, visits to emergency rooms for overdoses, and emergency medical services runs for overdoses. When these numbers trend in the same direction, an alert goes out to first responders and hospitals so that they can ramp up their services quickly and be ready to respond. Shortly, a Live Stories website will be up and running where any member of the public can check out the activity level in the county and take appropriate actions. Another area that the health department works on is our naloxone distribution program. It's called Project Dawn. We distribute no cost, that is free naloxone to any member of the Butler County community. Anyone who thinks that they may come in contact with someone who is experiencing an overdose is able to get this kit. It's allowed countless people to be successfully revived and steered into treatment and rehabilitation. A member of the community can call the health department to find out more about how to get a kit for themselves. Another area that involves the health department is containing the spread of infectious diseases. IV drug use has caused historically high levels of hepatitis C and HIV infections in our community. Since 2002, hepatitis C has grown by 322% in Butler County. Since 2013, HIV has gone up 46% in Butler County. This is a threat to everyone, but especially those who work in healthcare, law enforcement, and emergency medical services. We are charged at the health department by law with creating programs to respond to emerging infectious diseases. One proven way to decrease these diseases and curb the number of loose needles in parks, yards, and along roadways is to establish a bloodborne pathogen prevention program. One such program has been successfully running in Middletown, and another program is needed in the central or south central portion of our county where drug use is high. Finally, the health department has been working to understand the data surrounding drug overdoses. Along with the coroner and mental health, we are working to understand this epidemic county-wide, and we have hired new staff with expertise in epidemiology and data analysis to develop reports that will help everyone in the community respond more effectively to this very serious issue. The fallout from opioids and other drug use is huge and impacts every single person in our county. The numbers presented today demonstrate that we need to redouble our efforts to address this very, very serious health and mental health issue. And now I'll introduce to you Dr. Scott Rasmus, Executive Director of the Butler County Mental Health and Addiction Services Recovery Board, who will talk about what his agency is doing to respond.
Thank you, Commissioner Baylor. The MARS Board, which is what we're called, Butler County Mental Health and Addiction Recovery Services Board, has expanded prevention, harm reduction, and treatment services since the inception of its opiate business plan in April 2016, with increased funding from local, state, and federal sources. We are facing a drug challenge never experienced before that becomes more potent and lethal as each month passes, reaching a point that fentanyl and its analogs are 1,000 times more potent than heroin itself. They are lethal and deadly. So now I'll talk a little bit about the expansions that the MARS Board has embraced. In prevention services, we went from, in fiscal year 2016, about 4,500 youth and adults reached. This year, finalizing the data for last year, about 11,500 youth and adults will be touched by our prevention programming, emphasizing opiate prevention and alternatives to opiate education campaigns. Harm reduction, as Commissioner Baylor discussed, bloodborne pathogen prevention programs in calendar year 2018 has identified and exchanged 11,000 needles, as seen by 288 client visits in the Middletown area so far. All clients get treatment literature, HIV and Hep C testing, which is available to them, as well as referrals to treatment. And some of the clients who visited that prevention program have chosen to engage in treatment. Our opiate business plan has already budgeted 1 or 2 additional programs slated to come online over the next year. That's our target or so. Treatment. We've been increasing our provider base for detoxification services, so now we've added 1 and we'll soon add 2 in the Butler County area. We are doubling our detox capacity currently from the first 6 months of 2018 compared to the last 6 months of 2017. We also entered into a contract with Mary Haven Residential Treatment Facility for our youth, which is in the Columbus, Ohio area. We are supporting the expansion of residential treatment beds in Butler County. We've increased it by 16 beds so far and looking to increase another 16 beds over the coming year or 2. We're supporting capital and operation costs for a 16-bed new recovery housing facility in Hamilton, which is in the works right now and hopefully will come online in the next 6 months. We are targeting a 40-unit expansion over the next couple of years in recovery housing. We've added a text component to our Butler County Crisis Heroin Hope Line, which became live on February 1st this year, in hopes of reaching out to our youth and adults who prefer to communicate via text. Our 1-8444 crisis line is now fully operational and ready to accept text as well as voice calls. We've expanded our funding for medication-assisted treatment in the county, including funding 2 new board contract providers. That is currently in effect. We've expanded our capacity of quick response teams, threefold countywide, with better than a 50% linkage to treatment rate when those teams meet face-to-face with clients who've overdosed. One team had a successful treatment capture rate approaching 100% recently. We've received Ohio Department of Health's Violence Prevention Grant to expand a medical substance abuse integrated drug prevention program at Mercy Fairfield Hospital in their ED to connect patients with peer recovery specialists and care coordinators when substance abuse is indicated. We've rolled out in partnership with the Butler County Jail, or we are rolling out in partnership with the Butler County Jail, full-day mental health addiction treatment pod programming for men and women inmates, especially pregnant women. We're working on a 24/7, 365 behavioral health screening service program at the jail so that every inmate from Butler County are preliminarily evaluated for mental health or addiction issues right up front when entering the jail. We're also looking at new tracking software for behavioral health issues in the jail. And finally, on the innovation front, We are looking at a Bridge device. It's named Bridge, and it's an innovative detox, non-substance electronic device placed behind the ear to reduce the uncomfortableness of opiate detox symptoms and withdrawal. Basically, we're looking at piloting this with 2 providers soon in the county. And so with that aside, I want to ask Dr. Mattix and Commissioner Baylor to assist me with any questions you have. Thank you very much.
Are you disappointed?
Am I disappointed?
In the numbers.
Yes, I am. I'm saddened by it. We have so many efforts going on in the county to help decrease this, and yet we continue to see increases in deaths. So I'm hoping that 2018 will be better. As you can see, it's almost a moving target in terms of the drugs that we're seeing, the additional mental health issues that go with it. So I mean, it's a big beast, and what I'm encouraged with is that we do have programs in place. We are trying things, but it's going to take time to see that result. And so we have to be patient and let those services have some time to work. There's no quick fix. So we have to keep going on this. Hopefully next year's numbers will be better.
Is there anything that you're encouraged by in this whole report?
I'm encouraged that so many different organizations and community partners are grasping this, and some of the innovative things that Dr. Rasmus talked about, the idea of prevention, really getting this idea to kids and into schools and communities, that we, one, recognize it. I think recognition is a huge step in our community, and then deciding to do something about it and actually taking those steps. So I'm encouraged with that. I hope that it will result in fewer numbers. But mine is not the only metric. It's just a final metric, and we want to make changes all the way upstream in it.
Any idea why you're seeing such a high jump in meth-related cases?
Well, there's several theories on the meth. One is that it's being supplied from the cartels along with fentanyl or heroin, whatever else is being sold and distributed. So it's an additional product in their line of sales. The other, unfortunately, is that methamphetamine is not responsive to typical medical treatment for opioid addiction. So things like Suboxone or Vivitrol don't block the effects of the methamphetamine. So even though it's a completely different type of physical response than heroin or fentanyl, it still provides a change in their mental state, and can be it is not blocked by those treatment. I don't know, Scott, do you have something you want to add to that?
No, I think.
At the microphone.
Yeah. Oh, sorry. I think, I guess going back to the previous question about, overdose deaths, there's a lot of other metrics that we're looking at to measure our success in addressing this opiate epidemic, such as ED visits at the hospital, dispatch data, successful linkage to treatment, such as with our quick response teams. The expansiveness of this, I just want to emphasize to you, we treated almost 24,000 unique Butler County residents with Mars Board funding last year. This year we'll probably do 26,000 or 28,000 residents. So that number was 24,000. I just want to correct that if I made a mistake. But that's almost 10% of, we're heading towards 10% of the population here, which is very, very large and expansive. And you heard about the breadth of the programming that we have. So anyway, I just wanted to emphasize that.
You have a lot of programs and things that you've described here. You got a new generation always growing up and the like. One thing I haven't heard, what can mom and dad do to help?
I'm going to go back and answer the first two questions before that one. I am encouraged by the response of the public to this epidemic. I think that we have done our job in awareness. I think the public understands the issues now. When we used to bring up this topic a couple of years ago, the reaction was much different than it is today. Now people are asking, what can I do? How can I help? When we bring up the topic of a bloodborne pathogen prevention program, there is not the same kind of negativity that was present when that topic was brought up just even 2 years ago. And some of that links to the second question about meth. And there is a theory that because the public is now aware of opioids and how they kill you, they're choosing to use a different kind of drug, and that would be meth or cocaine. That's just a theory. I don't know. So I'll let the others start with the most recent question. What can mom and dad do?
I think just in generally, sure. Generally an awareness, and obviously emphasizing a good relationship with your son or daughter, to be awareness of their friends, you know what they're doing, and especially if there's changes in behavior with your son or daughter, and hopefully to be able to sit down and discuss these. And if any drug or mental health issues are identified, to reach out. I know in Butler County we got 1-8444 crisis, which is not only a crisis hotline and a heroin hope line, but also it has information and referral components to it, or to call the board, and the board gladly will offer referrals to our provider network.
It's not just
The
children.
county health department has a community health improvement plan, and one of the pieces of that is a prevention section that is working with prevention partners to bring programs to every school district in the county that will address evidence-based ways of decreasing drug use, starting with very young children and then following them throughout the grades. So that's a long-term project, but in many ways we need to shift our focus to those who haven't become involved at all with drugs yet and make sure that they never do. So that's something that mom and dad can do, get involved with that kind of program.
I was just looking at a site here that says that just about 3/4 of the human-caused deaths between homicide and suicide, 3/4 of deaths from those two are from suicide. It's in the United States. Seems to show that we've got a pretty unhappy population if that's kind of things happening. Is there any way, before, it gets to the point of, who's your kids hanging with, of us addressing that basic happiness issue that I would imagine could lead to getting involved in drugs?
You want to take that?
Yeah, I guess it's a pretty complex question. I think not only, and I think this gets back to the question I talked about youth, it also gets to adults too, and being aware of family members, friends, and changes in behavior. But I think it's an awareness of, obviously we live in a fast-paced society, and to be aware of stress and negative influences on our psyche, our emotions, and things like to do things that promote stress reduction and relaxation, and also to be aware of the signs and symptoms of things like suicide and depression and anxiety and drug use, and then to, I guess, be open to talk about it and to seek help and seek treatment. Treatment works, people recover. There's very good statistics on that, no matter if it's addiction issues or mental health issues. So anyway, I hope I've answered your question.
Many law enforcement agencies don't carry Narcan. Does that make an impact at all on these numbers?
I wish everyone could carry Narcan, but there are forces that prevent that. EMS is a pretty fast responder, so we are hopeful that does the trick for most people.
And I would just add to that, and Jenny, may I use your prop?
Yes.
So when Commissioner Baylor mentioned the Narcan, I mean, this is available for families, for parents, for anyone in the community that feel they may encounter someone that has overdosed. So you're right, maybe we should all be carrying Narcan. especially if we have family members or in situations that we would encounter somebody at risk. So the Narcan's not just about medical professionals or first responders carrying it, but that as a community we can think about this and have it available.
Have you passed out a lot of these? I mean, since you
Yeah, I guess I would follow up and say we could all carry Narcan. We have enough that we could do that. It comes to the county free from the Ohio Department of Health, and as many people as want to have this can have it. So that would be my wish.
Thank you very much for coming today.